Good morning. Welcome to this presentation on advancing global hepatitis elimination. Today, we'll explore the critical priorities needed to achieve the World Health Organization's ambitious 2030 elimination goals. This presentation focuses on three key pillars: research innovations, service delivery transformations, and advocacy strategies. Hepatitis B and C represent one of the most significant global health challenges, yet they are entirely preventable and treatable. So our discussion today is structured around four main areas. We'll start with the global landscape to understand the current situation. Then we'll examine research priorities that are driving innovation. Next, we'll explore the new service delivery models that are improving access. And lastly, we'll discuss final advocacy strategies that are building political momentum for elimination. So the global statistics state that 304 million people worldwide are living with hepatitis. The scale of hepatitis crisis cannot be overstated, and that is hepatitis B or C. So this represents nearly 4% of the global population. What particularly concerns us is, despite having effective tools for prevention, diagnosis, and treatment, these remain out of reach for the vast majority of the population. This statistic underscores why we need urgent, coordinated global action across all sectors. Now let's look at the global progress. So this chart illustrates the stark reality of our current treatment graphs. So the dark blue represents the diagnosis rates, and the teal or lighter blue represents treatment access. So this is a scale of the amount of people or the percentage and the months of the year. So for hepatitis B, only 13% of those infected have been diagnosed. So less than 3% are receiving life-saving antiviral treatment. For hepatitis C, while we have made more progress, with 36% have been diagnosed between 2015 and 2022, only 20% have received curative treatment. So the trend line shows gradual improvement. As you can see, it's upward, so it's a positive correlation. But at this pace, we will not meet the 2030 goals. This data emphasizes the need for accelerated action and innovative approaches. Now let's discuss research priorities for both hepatitis B and hepatitis C. So due to the nature of the characteristics of each of them, they have significantly different research priorities. Let's speak about hepatitis B first. So hepatitis B, there's operational research roadmap that focuses on the simplification for low resource settings. So this is particularly represented in Africa, where the birth dose vaccination implementation remains challenging. Key research includes developing point-of-care diagnostics and simplified treatment algorithms. Additionally, point-of-care diagnostics for community-based testing programs. Meanwhile, for hepatitis C, the TIP Hep C project addresses a critical gap: treatment during pregnancy, which has been largely overlooked. Also, microelimination strategies for high-risk populations. So like people who inject drugs, healthcare workers, and incarcerated individuals. And finally, cost-effective models for country-specific elimination pathway development. So let's speak about service delivery. So the service delivery framework is split up into three main factors. So strategic planning, implementation, model, and scale-up strategy. So though it's split up in three main factors, there is a five-step framework that has been developed by the World Health Organization for person-centered hepatitis testing and care. So firstly, the strategic planning is the community leadership and stakeholder engagement from the outset. Next, the implementation models focus on integrating hepatitis services into existing primary healthcare systems. Lastly, the scale-up strategy emphasizes universal health coverage integration with sustainable financing mechanisms. This systematic approach ensures that services are not only effective, but also equitable and sustainable. Now let's speak about service models. So the service models are split up into three: community programs, facility integration, and digital innovation. So first, let's speak about community programs. So these are community-based approaches with demand creation and mobilization for early detection and intervention. So successful hepatitis elimination requires diverse service delivery models that are tailored to different population and settings. The community programs bring testing directly to high prevalent areas using mobile units and peer educators. The facility integration has healthcare facility integration with primary care services and specialist referral pathways established, thus allowing two-way communication between the healthcare provider and the patients. So there are routine testing in antenatal and HIV clinics. There is provider training and capacity building programs, so everyone that is employed can be up to date. And there is use of electronic health records, which is EHR, that is there for future use of the records and patient tracking. So there's always a way to communicate and to know what's going on with them. And lastly, I love digital health, and digital innovation is the last model, which digital health creates solutions that enable telemedicine, telehealth, and remote monitoring for improved access. So this is where there is point of care diagnostics, telemedicine, and AI-powered risk stratification. So the use of mobile health application, e-health for patient engagement, artificial intelligence for risk stratification. Note that each model addresses different barriers to access and reaches different population segments. Okay, so the next is advocacy and partnership. So advocacy has been crucial in building political momentum for hepatitis. We have seen that coalition, the UN Group of Friends, has gone from 12 to 55 countries, and policy development, there has been efforts to create elimination nationally and political briefs that demonstrate both health and economic benefits. Here we see the implementation framework. The blue shows we're strongest in integration, but weakest in testing. That's current performance. Industry averages is in orange, and that shows that we're achievable with current practices. And 2030 targets, which is our goal, is in orange, which is showing that the ambitious goals that we need to reach. So the hepatitis elimination is achievable, but only through coordinated global action. We have tools like effective vaccines, rapid diagnostics, and curative treatment. What we need now is political will, financial commitment, and operational excellence to deliver these tools at the scale that we need. The Coalition for Global Hepatitis Elimination continues to work toward the WHO 2030 goals through strategic partnerships. Every stakeholder, whether it may be the government, healthcare providers, research and advocates, and committees, have a role to play. Together, we can create a hepatitis-free future and save millions of lives. That is the end of the presentation. If there's any questions or concerns about funding, equity, innovation, political commitment and integration, I'm happy to speak about it. Thank you.